Next disease, that is hypothyroidism. It is also disease of what? Your thyroid gland. Its name itself indicate hypo, it means less or low. So what is meant by hypothyroidism? It means what? It is a abnormally low the activity of thyroid gland, and due to this lowering the activity, what will happen? Which results in retardation of growth and mental development in children and adult. I am repeating. Yes, hypothyroidism. Hypo, it means low or less. So what is meant by hypothyroidism? It means there is low activity of thyroid gland, and due to this low activity, which results in retardation of growth and the mental development in children as well as adult. Here we can see the epidemiology. Worldwide, about 1 billion people are estimated to be iodine deficient. However, it is unknown how often this result in hypothyroidism. Then, in large population-based studies in Western countries with sufficient dietary iodine, 0.3 to 0.4% of population have hypothyroidism. In large population, 4.3 to 8.5%. Then women are more likely to develop hyperthyroidism than the men. Then what are the risk factors for hypothyroidism? First, that is, although anyone can develop hypothyroidism, you are at a increased risk if you, first, that is older age, that is more than 60. Then if you have any autoimmune disease, then have family history of thyroid disease, then other autoimmune disease such as rheumatoid arthritis or lupus, or any chronic inflammatory condition. Then next risk factor, have been treated with radioactive iodine or the anti-thyroid medication. Then next factor, received radiation to your neck or upper chest. Then had thyroid surgery. Then have been pregnant or delivered a baby within the past 6 months. These are the few risk factors. First, that is older age. Then second, autoimmune disease. Then next, family history of thyroid disease. Next, autoimmune disease such as, or for example, rheumatoid arthritis or lupus, or any chronic inflammatory condition. Then have been treated with, next factor, have been treated with radioactive iodine or the anti-thyroid medication. Then received radiation to your neck or upper chest, have had thyroid surgery, and last, that is, have been pregnant or delivered a baby within a past 6 months. Then next, that is causes of hyperthyroidism. It means etiology. First, that is medication, then genetic dysfunction, then previous thyroid surgery, then next treatment for hyperthyroidism, then radiation therapy, then next damage to the pituitary gland, and next autoimmune thyroid disease. We will see one by one. First, that is medication. There are different or number of medications can cause hyperthyroidism. For example, lithium, which is used to treat certain psychiatric disorders, and which also which can affect the thyroid gland. I am repeating, see here, there are different number of medications, so different medications which can cause hyperthyroidism. For example, what? This lithium, which is used in treatment of certain psychiatric disorders, and which can cause or also affect the thyroid gland. Then next, that is genetic dysfunctions. The thyroid gland may be dysfunctional at birth or may fail at some phase in adult life. Then previous thyroid surgery. For example, removal of large portion or the entire thyroid gland may reduce or stop the process of thyroid hormone production. Then next, treatment for hyperthyroidism. The treatment for hyperthyroidism may sometimes result in hypothyroidism. Then radiation therapy. Then in that, what? The exposure of the thyroid gland to radiation therapy. Exposure of the thyroid gland to the radiation therapy for the treatment of cancer of the head and neck region may result in hypothyroidism. I am repeating here, exposure of thyroid gland to radiation therapy for the treatment of what? Treatment of cancers of the head and neck region may result in or may cause as hypothyroidism. Then damage to the pituitary gland. The gland may be damaged due to disease or surgery which may result in decreased level of thyroid hormone. Decreased level of thyroid hormone. Then autoimmune disease or autoimmune thyroid diseases. This is the most common cause of hypothyroidism. This happens when the body immune system produce a certain antibodies and that attack its own thyroid gland and which cause or which leads to reduced the production of or the less production of your thyroid hormone. Here we can see the hypothyroidism, thyroid cell, then necrosis, apoptosis, attenuate. Here we can see this thyroid cell death. Then different signs and symptoms. First, hypothyroidism sign and symptoms, it may include the first, that is fatigue. Then second, increased sensitivity to cold. Then next, constipation, dry skin, impaired memory. Then weight gain. Then puffy face, hoarseness. Then muscle weakness, elevated or increased blood cholesterol level. Then muscle ache, tenderness and stiffness. Then pain, stiffness or swelling in your joints. Then heavier than normal or irregular menstrual periods. Then thinning hair, slowed heart rate or decreased heart rate. Then depression and impaired memory. These are the few signs and symptoms of your hypothyroidism. Here you can see the symptoms: coldness, fatigue, feeling cold, weight gain with poor appetite, hair loss, then shortness of breathing, paresthesia, then constipation. Here we can see the signs and symptoms. So next, that is investigation or the diagnosis. For the investigation or the further diagnosis of hypothyroidism, first that is history examination, then second physical examination, serum for T3 and T4 cell, then serum TSH, that is thyroid stimulating hormone, then serum cholesterol and TRH stimulation test. So what is treatment for this thyroid hormone replacement? For example, levothyroxine. Then monitored thyroid hormone level and adjust the dose, and next nutritional therapy to promote weight loss. So this is all about hypothyroidism.